Hi, so we're going to talk about some of the muscles of the lower extremity, starting with the Psoas Major, which its origin is going to be the vertebra and the intervertebral disc of T12 through L5, and it's going to insert into that lesser trochanter, and its main action is flexing the thigh right here. So something as simple as touching your toes would be a good example of how this would work, how that exercise might help strengthen flexion. And then we will have the Pectineus, which it does perform some flexion action, but it also does a lot of adduction, so bringing this femur over closer into midline when it contracts. So some people put some kind of elastic bands that are sturdy in like a circle between their thighs, and they squeeze them together, and that is an exercise that can help make them stronger with their Pectineus. And so its origin is going to be the superior aspect of the ramus of the pubis, and it's going to insert in that pectineal line. So the Adductor Magnus has a lot going on for it. It has kind of two aspects for it. It has the adductor aspect and then the hamstrings aspect. So the adductor aspect will have its origin on the inferior aspect of the ramus of the pubis, and also the ramus of the ischium right in here. And it is going to insert at the gluteal tuberosity, the linea aspera, as well as the medial supracondylar line. The hamstrings aspect will insert at the ischial, have its origin at the ischial tuberosity, and then insert into the adductor tubercle. And it is a adductor, so it's also going to do that action of bringing in the femur, the leg, the thigh, closer to midline, closer to the other leg that is opposite to it. But the hamstrings portion also performs extension, and the adductor portion will also perform flexion. So there's a bunch of different exercises that you could do to strengthen it, and that makes sense because of how big it is. And you could do, again, like squeezing in some elastic bar band type things together, but you could also do different things. I think running and things like that are a great way to strengthen it because you'll be performing some flexion and then some extension while you're running. The gastrocnemius muscles will have their origins on the condyles of the femur, the medial aspect being more of the popliteal. And then they will have their insertions via the calcaneal tendon into the calcaneus. Calcaneal tendon is also called the Achilles tendon. And these muscles are going to perform plantar flexion. So that sort of action where you go tiptoe. And so I think a fantastic exercise for these are calf raises. So standing on your tiptoes and then going back to neutral. The popliteus, it performs some flexion, but it will also perform some lateral rotation as well as some internal rotation. And I think that's just, it can kind of be seen because of the way it is shaped. So when you can imagine this contracting, you can imagine some of the flexion, but also some of that rotation being internal, as well as some lateral. And so I think that one of the best things you could do for this is, running, different things like that can help strengthen it. But if you wanted to do some more with the flexion, you could attach an elastic band around the ankle and try pulling it up when you're moving into flexion, and that could help strengthen the popliteus. And there's other muscles that we'll be discussing that will be doing that exercise as well. And so its origin is going to be on the lateral aspect of the lateral condyle of the femur down into the soleal line of the tibia. The Peroneus Longus will have its origin on the superior aspect, the head of the fibula, as well as the upper 2/3 of the fibula, and is going to insert on the base of the medial of the first metatarsal as well as the medial cuneiform. And what this is going to do, it is going to do eversion, so bring that the bottom aspect of your foot out. So bring it out and away from you, not towards inversion, so not towards midline, but out. And the plantar flexion would be similar to what the gastrocnemius did. So I think calf raises are also something applicable to strengthen this muscle as well in plantar flexion. So with the gluteus minimus, it will have its origin in between the anterior gluteal line and the inferior gluteal line, and it is then going to insert into the greater, and it performs some abduction as well as medial rotation. And so you could perform jumping jack type motions with this muscle to strengthen it, but you could also, with elastic bands, do some medial rotation to strengthen it. So it's good to have options with your muscles. And with the Quadratus Femoris, it does lateral rotation. So it will be bringing the thigh out laterally. So you could also strengthen that by using some elastic bands as well, which I gotta love those elastic bands because there are so many uses for them. And its origin is going to be in the lateral aspect of the ischial tuberosity into the, I'm going to say this right, quadrate tubercle of the intertrochanteric crest. There we go. And then with the biceps femoris, it will have the long head origin on the ischial tuberosity, the short head on the linea aspera, as well as the lateral supracondylar line into, and then they're both going to insert into the fibular head. And this is going to perform flexion at the knee, so it'll be bringing the tibia fibia up over into flexion with the other hamstrings. And so this is also something I think you could exercise just by running, just by biking, because you will be performing so much flexion with that against the resistance of your own body. But you could also do some raises into flexion against gravity with resistance of elastic bands if you wanted to. The Vastus Lateralis, it will have its origin on the greater trochanter as well as the lateral aspect of the linea aspera, and it will then insert into the quadriceps tendon. And what it is going to do is it is going to help extend the leg at the knee area. So when it contracts, it will help bring the bottom portion of the leg up and out. So you could think of like kicking a soccer ball. I feel like that's a great, way of thinking about how the vastus lateralis could work with the other quad muscles. So you could exercise it by doing some kicking motions out. And you could do that, I feel like with a soccer ball or different things like that, but you could also use an elastic band if you wanted to bring it out against resistance, have it strapped around the ankle. And talked about the origins and insertion, so we are good to go on that one. And then the Obturator Internus, so it will perform lateral rotation as well as extension and abduction of the thigh. And it will have its origin at the pelvic surface of the obturator membrane. So I feel like it kind of, in that portion of the obturator foramen, will have its origin. And then it is going to insert into the greater trochanter. And because it does all those different motions, you could use different elastic bands to either abduct or extend the thigh or laterally rotate if you wanted to. But you could do things like jumping jacks, or you could do some running. That could also help. And those are all of my muscles. Thank you.